name is Sarah Russell. I'll be your nurse today. I have performed hand hygiene and ensured patient privacy. Can you tell me your name and date of birth?
Diana Russell, 7161.
I'm going to begin the head-to-toe assessment now. To begin, you would do a general inspection, perform an initial focus inspection to detect signs of disease or distress. You assess the patient's mobility, posture, build, deformities, dress, and grooming. You would assess skin color, facial expression, alertness, eye contact. You would assess their speech, hearing, or vision concerns, obtain patient's height and weight, check distance vision with a Snellen chart, and take the patient's vitals. The patient appears to be mobile, posture is good, build is good, there appears to be no deformities, the dress is appropriate, and grooming is appropriate. Skin color is normal, facial expression is normal, alertness is normal, the patient is making eye contact, the patient speaks clearly, can hear. Are there any vision concerns?
No.
I would at this time obtain the patient's height and weight, and I would check the distance vision with a Snellen chart if I had one, and I will take the patient's vitals. I'm going to take your blood pressure. Turn it on now, please. Blood pressure is 100/70. I'm going to take the pulse. The pulse is 80. Respirations are 18. You would inspect, after that, you would inspect the head and face. You inspect skin, eyes, ears, and skull for symmetry and abnormalities. The skin appears to be normal, the eyes and ears are normal, and the skull appears to be symmetrical and there's no abnormalities. Next, I would inspect and palpate the scalp and hair. Can you take your glasses off? There's no abnormalities of the scalp and hair. And then next you would palpate the temporomandibular joint. Can you open your jaw? Thank you. Can you close it? After that, you would palpate the facial bones and maxillary sinuses. And then you would test for cranial nerves number 7 and number 5. Can you clench your teeth? Can you close your eyes? Can you wrinkle your forehead? You can open your eyes. Can you smile? Can you stick out your tongue? Can you puff out your cheeks? Thank you. I'm going to test for light sensation on forehead, cheeks, and chin. Can you feel that?
Yes.
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 Next, you inspect the eyelids, brows, sclera, and other external structures. Everything appears to be normal. Then you would palpate the lacrimal glands. Can you open your eyes? Thank you. And then you would test the patient's near vision with a rebound chart, and it would test for cranial nerve. Number 2, the optic nerve. I don't have a rebound chart, but if you did, you would do that. You would assess for pupillary response to light. Can you look straight ahead? Pupils reacted normally. Check the corneal light reflex. Same reflection in each eye. Can you look at me? There's the same corneal light reflex. You would assess for extraocular movements, cranial nerves 3, 4, and 6 by moving the pen around. Can you follow the pen? The extraocular movements appear to be normal. You would assess the visual fields for the optic nerve also. Can you hold that in front of that eye? Can you tell me when you see my fingers?
Yeah. Start do that one more at a time.
Can you tell me when you see my fingers?
I can see them now.
Good.
I can see them. I can see them.
Can you see my fingers?
Yes.
Can you see my fingers?
Yes.
Okay. Can you switch your eyes? Can you see my fingers?
Yes.
I'm supposed to like walk
good peripheral vision.
Can you see my fingers?
Yes.
Can you see my fingers?
Yes. Yes.
Okay. The patient appears to have good visual fields. Then you would test the red reflex with the ophthalmoscope, but I do not have one. And you would inspect the retina also for red reflex, optic disc, retinal vessels, and other structures. Next, you would inspect the ears and palpate the auricles. Note alignment of ears, placement, and surface characteristics. The ears appear to be normal, no abnormalities. And then you would just next you'd evaluate hearing, which is the cranial nerve number 8, vestibular cochlear, by doing the whisper test. Can you stick a finger in your other ear and wiggle it? And then tell me the word I whisper to you.
Dog.
And then other side. Could you tell me the word I whisper to you?
Apple.
And you would inspect the external auditory canals and tympanic membranes if you had the otoscope. And upon inspection, everything should be pearly gray. Next, you would perform the Weber and Rhine test. After that, you would inspect the nose and check the nostrils for patency. Can you take a deep breath? Can you take a deep breath? Next, you would inspect the nasal mucosa, septum, and turbinates. You would use a nasal speculum. Test the patient's sense of smell. Could you close your eyes and tell me what you're going to smell? Smell?
Coffee.
Next, you'd inspect the mouth and the pharynx. You'd and you would inspect the inside of the mouth. Can I see inside your mouth? Everything appears to be normal. Then you would inspect the mouth, inspect the lips, the buccal mucosa, teeth, gums, and tongue. Can you open your mouth again? Everything appears to be normal. Next, you inspect the oropharynx and have them say ah. Can you open your mouth and say ah?
Ah. Ah.
Everything appears to be normal. Next, you would check the gag reflex. Can you open your mouth? I'm sorry, this is gonna get. And then you would check the taste response. Could you lick your finger? Tell me if it's salty, sweet, or bitter.
Salty.
Then next you would inspect the neck structures, the thyroid and jugular veins. There appears to be no jugular distension or noticeable thyroid. Then have the patient show your. Can you touch your chin to your neck? Then tilt your head back. Tilt your head to the right towards your shoulder. Tilt your head to the left towards your shoulder. And then can you shrug your shoulders? Thank you. Can you shrug your shoulders? Okay. Can you turn your head to the right? Okay. Can you turn your head to the right? Okay. Then you would palpate the carotid arteries, the position of the trachea, and the thyroid gland. Then you would palpate the regional lymph nodes and auscultate for bruits in the carotid arteries and the thyroid gland if it is enlarged. Then after that you would inspect the upper extremities and you would inspect the hands, arms, and shoulders, including skin and nail characteristics. Could you take your shirt off? Everything appears to be normal. Inspect the muscle mass and strength. Can you move your arm to the side? Can you move your arm up? Can you move your arm down? Can you move your arm up? Can you move it out? And then down. Everything appears to be normal. Check joint range of motion. Can you and can you do it in the other arm? Then you would palpate the radial and brachial pulses. And then you would palpate the epitrochlear nodes inside the bicep with the right arm towards the elbow. Everything appears to be normal. Next, you would inspect the back of the patient and posterior chest wall. Note the skin and thoracic shape, shoulder symmetry, and muscle development. Everything appears to be normal. Then you would inspect and palpate the spine and scapula, and you would percuss the spine. Could you turn away to the side a little bit? You would percuss down the center of the spine. And then you would inspect, and then you would percuss the costo-vertebral angle. Does that hurt?
No.
Just turn the other way. Does that hurt?
No.
And then could you turn back that way? Then check the spine again. And the scapula. Next, you would move on to the lungs and observe for excursion. Can you take a deep breath? Okay, deep breath. Then you would note for respiratory depth, rhythm, and pattern. Everything appears to be normal. You would check the thoracic expansion during respiration. Could you turn to your side again? And can you take a deep breath? Then you would palpate for tactile firmness and have the person say 99. Okay. Can you say 99?
99.
Can you say it again?
99.
Can you say it again?
99.
Again?
99.
Again?
99.
Again?
99.
And then, can you sit around front again? Can you say 99?
99.
Again?
99.
Again?
99. 99. 99. 99. 99. 99.
And you would percuss the posterior and lateral chest walls for resonance. Okay. Can you turn back? And now I would percuss the chest wall. Then you would percuss the diaphragm for diaphragmatic excursion. And then you would auscultate for breath sounds, noting characteristics of any sounds. Can you take a deep breath? Deep breath. Deep breath. And then could you turn to your side again? Can you take a deep breath? There are no abnormal breath sounds. Everything is clear. Next, you would perform a general visual inspection. You would inspect the skin, muscles, symmetry, and respirations. Everything appears to be normal. You would palpate the chest wall. Then you'd palpate the pericardium and locate the point of maximal impulse. Then you would palpate the lymph nodes and percuss for resonance and auscultate for breath sounds. So I'm going to palpate the lymph nodes. Could you lift your arm up? Should lift this arm up. Then you percuss for resonance and auscultate for breath sounds. And now I'd auscultate for breath sounds, or heart sounds. Heart sounds appear to be normal. Then you would examine jugular vein pulsations and estimate jugular venous pressure. There appears to be no jugular vein distension. And then you'd palpate the chest wall and auscultate the heart sounds systemically and turn the patient on the left side. Okay, can you lay down? Just palpate the chest wall again. And then you would listen to heart sounds again. Heart sounds are normal. Then you would inspect next you would move on to the abdomen, and you would inspect the abdominal skin and characteristics for contour. Can you lay on your back? Everything appears normal, symmetrical, the color is normal. Then you would auscultate the bowel sounds in each of the 4 quadrants. Bowel sounds are present in all 4 quadrants. Then you would auscultate for bruits and venous hums over the aorta. No bruits or hums. Then you would percuss all 4 quadrants. First, you would also auscultate the renal arteries, the iliac arteries, and the femoral arteries. Next, you'd percuss all 4 quadrants. And then percuss to estimate the liver span and splenic dullness. Can you let your legs flat? Thank you. And then you would palpate lightly and moderately and deeply in all 4 quadrants. Next, you would palpate for specific organs, the liver, spleen, and kidneys, and aorta. Then you would test the abdominal reflex. And then inspect the abdomen for muscle contraction. Can you raise your head? Okay. And then you would inspect the lower extremities and inspect the feet and the legs. Take your socks off. You'd palpate for temperature and texture. And then test for edema. And then assess lower extremity pulses. Assessing the dorsalis pedis pulse, posterior tibial pulse, and the popliteal pulse. Then you would assess toe ranges of motion. Can you bend your toes down? Can you bend your toes up? Can you bend your foot up? Can you bend your foot, point your feet? Can you turn your feet in? Can you turn your feet away? Can you rotate your ankle in? Can you rotate your ankle out? And then you would assess ranges of motion. That also assessed range of motion of feet, ankles, and knees. And then you would inspect hips and test range of motion and strength. Can Can you bring your leg up? Can you bring it down? Can you bring your knee to your chest? That's good. And then can you swing your leg out as far as you can? Okay. Can you swing it across your body the other way? Thank you. Can you, on the other leg, can you bring your leg up? Can you bring it down? Can you bring your knee to your chest? Okay. Can you swing it out? Can you swing it across your body? Okay. Assess coordination, muscle use, and ease of movement. That assess the coordination, muscle use, and ease of movement. Then neurological, everything appeared to be normal. She has full range of motion and easy use of muscle use. Next, she would check the neurological system and assess sensory and motor function and coordination, position, sense, reflexes, spinal motion, and proprioception. Um, um, okay, this is going to be, can you lay your arms? This is going to be soft. This is going to be sharp. When I touch you, can you tell me if it's sharp or dull?
Dull. 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 I said all dull. I don't think it's pokey enough. I felt the thing.
Okay. Try that again.
Okay.
Okay, this is gonna be sharp.
Sharp? Okay.
I got it for you. This is gonna be sharp.
Okay.
That's dull.
Okay. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Then you would assess for the vibratory test, the wrist and the ankle, but I don't have that. And then you would assess for 2-point discrimination. Can you show me your palm? How many points?
2.
How many points?
1.
How many points?
1.
How many points?
2.
How many points?
1.
Okay. Then you would test for strychnosis and okay. Can you tell me how many back to the point test. Can you tell me how many points?
1. 2.
Can you tell me how many points?
2.
Can you roll onto your side? Can you tell me your points?
1.
Okay, thank you. The patient has some discrimination between points. Then you would test the strychnosis test and put some. You would put something in their hand and have them tell you what it is. Can you tell me what this is?
Rubber band.
Thank you. And the next you would test the graphesthesia test. And can I see your hand? Can you tell me what I draw on it?
Number 2.
Yes. Okay, can you sit up again? Okay, now you would test the patient's fine motor function and coordination. Can you put your arms out like that? Can you close your eyes? Can you touch your index finger to your nose? And your other, yeah, okay. Okay, thank you. And can you touch each finger to the thumb on the same hand? And then do it. Alright, thank you. And then, open your eyes. Okay, can you touch from your nose to my finger? Thank you. And then test the position sense. Can you close your eyes and move your toes? Okay. Can you bend your knee? Can you rub your shin down your opposite, or rub your heel down your opposite shin? Okay. Can you do it on the other leg? Thank you. And then you would test spinal reflexes bilaterally in their biceps, triceps, and brachioradialis. I don't have the tools, but you would test that, and the arm would flinch, and then you would inspect and palpate the spine and test for spinal movements. Could you stand up? Okay. Could you face that wall? Okay, could you bend over? Okay, could you bend backwards as far as you could? Okay, thank you. And then could you twist to the side and twist to the other side? Okay. Um, and then you observe the patient's gait. Could you walk and then walk towards me? Okay. And then could you close your eyes and just stand there? And then could you stand on one foot and then stand on the other?
With my eyes closed?
Yeah. Yes. Keep your eyes closed and stand on the other. And then okay, you're good. And then could you keep your eyes closed and hop on your left? Okay, thank you. Could you do it on your right? Okay. Thank you. And then at this time you would then assess, depending on the patient, male or female genitalia, and you would inspect the external structures. For the male, palpate the scrotal contents, test for sacrococcygeal and perianal areas. You would obtain a rectal culture if needed, palpate the prostate gland and seminal vesicles, note characteristics of stool, and test for occult blood if indicated. For female genitalia, you would put them in the lithotomy position. You would inspect their pubic hair, their labia, their clit, their urethral and vaginal openings, and perineal and perianal areas. You would inspect the genitalia, palpate the labia and glands, the Bartholin and scheme glands. You would perform a speculum examination and collect specimens as needed, and inspect the vagina and cervix and collect specimens. For pap smear, you would perform a bimanual palpation, perform a recto-vaginal examination, perform a rectal exam, and obtain a rectal culture if needed, note characteristics of stool, and test it for an occult blood if indicated. And that is the end of the head to toe.